Bismillahirrahmanirrahim. This is the second news on 30th March newspaper front page dawn. 26 cities record over 8% positivity rate. President, Defense Minister test positive. Prime Minister's AD advises provinces to procure vaccine. 4,525 new patients detected. Virus claims 41 lives in single day. By Ikram Junedi. Islamabad, with President Dr. Arif Alvi, and Defense Minister Pervez Khattak joining the list of dignitaries having contracted COVID-19 at the National Command and Operation Center, NCOC, on Monday identified 26 cities with over 8% positivity ratio. On the other hand, an age and gender distribution chart showed that people in the age group of 20 to 40 years were the most affected by COVID-19. But the highest rate of casualty was among patients in the age bracket of 60 to 70 years. Special Assistant to the Prime Minister on Health, Dr. Faisal Sultan, meanwhile urged provinces to procure vaccines. President Alvi had confirmed his diagnosis through a tweet saying, I have tested positive for COVID-19. May Allah have mercy on all COVID affectees. Had a first dose of vaccine, but antibodies started developing after second dose that was due in a week. Please continue to be careful. Similarly, according to media reports, Defense Minister Pervez Khattak was also found to be infected by the virus. Sindh Governor Imran Ismail had also announced that Defense Minister Pervez Khattak had been infected by the virus. In a tweet, Governor Ismail said, Pervez Khattak is diagnosed with COVID positive. Get well soon, PK. It may be mentioned here that Prime Minister Imran Khan and his wife Bushra Bibi have also tested positive over a week ago. Meanwhile, the NCOC on Monday revealed that 26 cities had a positivity rate of over 8%. They are Islamabad, Lahore, Rawalpindi, Sialkot, Sargodha, Shekhupura, Gujarat, Bahawalpur, Toba Tek Singh, Faisalabad, Gujranwala, Mandi Bahudin, Multan, Okara, Rahim Yar Khan, Peshawar, Swat, Navshera, Dir Lower, Malakand, Sababi, Charsadda, Haripur, Muzaffarabad, Mirpur, and Kotli. On March 28, the NCOC had imposed a ban on all kinds of gatherings and wedding ceremonies in cities where the infection rate was more than 8%. The center had also suggested reduction in transportation between provinces. And advised the provincial governments to expedite vaccination against the deadly virus. The NCOC data showed that 4,525 cases and 41 deaths were reported in a single day, while 387 ventilators were in use. The highest number of beds was occupied in Multan, where the percentage was 67%, followed by 64% in Islamabad, 60% in Gujranwala, and 52% in Lahore. The data on oxygenated beds showed that Gujranwala had an 85% occupancy rate, Peshawar 78%, Swat 73%, and Gujarat 70%. The number of active cases was 46,663, while 3,648 patients were admitted to hospitals across the country on Monday. On the other hand, Dr. Faisal Sultan on Monday advised the provinces to procure vaccine. The federal government has procured and will continue to procure COVID vaccine for all Pakistanis. At the same time, there is no NOC requirement for any NOC pending or bar for any provincial government to procure any registered vaccine if they are able to. Any facilitation needed will be provided, the special assistant tweeted. Vulnerable groups. According to a document of the NCOC available with Dawn, people in the age group of 20 to 40 years and 60 to 70 years were most vulnerable to COVID-19. In the 20 to 40 age bracket, and the infection rate was high as 183,427 males, 91,035 females, and 9 from the transgender community contracted the virus. The data on deaths showed that 2,750 males, 1,301 females, and 1 person from the transgender community in the 60 to 70 age group had succumbed to the virus. Umar writes to provinces. Minister for Planning and Development, Asad Umar, has written a letter to the provinces suggesting them to implement non-pharmaceutical interventions. As you know, the current wave of COVID-19 is spreading at an exponential pace, and a positivity ratio across the country is rising at an alarming rate. NCOC, in consultation with federating units, is keeping a close watch on the situation and correspondingly data-driven decisions are being made in order to reduce the spread of the disease, he said. And in the end, the formal request, if you have not yet, please subscribe our channel and press the like and bell button to get the press from us. Thank you for watching. Have a nice time and goodbye.